To modify the Easdent tray for partial edentulous arch, compare the arch form of Easdent tray with the patient's first. If necessary, Easdent tray can be softened in the hot water temperature higher than 65 degrees Celsius or 149 degrees Fahrenheit. Then pull or push to adjust the width of the tray to make the arch form matching the patient's arch form. Measure the size of the edentulous spaces and the size of existing teeth using Easdent measure. Because the teeth are not the same size measuring from root areas or the height of contour at the contact areas, try to measure the height of contour every time. Mark these dimensions on the Easdent tray. Mark on the tray with black pen to indicate the junction between the existing teeth and the edentulous spaces. Cross out these teeth with the black pen. You will cut away the teeth on the Easdent trays to make holes for the patient's existing teeth to pass through. Then mark 2 mm away from the existing teeth with red lines as cutting lines. These marks will be very helpful to know where to cut and where to keep. The extra 2 mm will give bigger holes and facilitate an easier fitting of the trays around the existing teeth. You can keep half of the tooth from the tray. You can also use very fast-setting PVS impression material like the fast bite registration material to find the location of the teeth matching on the tray. Load some bite registration material in the tray. Seat the tray in the mouth. Patient's existing teeth will form indentations in the material. Mark on the tray where to cut the hole for the existing teeth. Cut the holes. Give extra room for the teeth to pass through the tray to allow the tray to move around. This method works well if the patient only has a few teeth left and most of the teeth are in the posterior. Soften the tray in the hot water, then reinsert it into the patient's mouth. Let the patient bite down and move the tray around to position the teeth in line with the arch and having the correct midline and horizontal plane. When the tray is still soft, apply gentle pressure on the buccal and lingual support frame to make them adapt better to the ridge. Move the tray around to ensure there is some space between the tray and the intraoral tissues. You can rewarm the supporting frame by dipping just the area into hot water and modify the area only. After the tray is hardened in the mouth, you can use the patient's lip and tongue movement to check for any overextension at the border of the supporting frame. If the tray feels like being pushed up or the patients complain about being hurt somewhere, the supporting frame has an overextended area. Identify the area and remove it. Again, you can use the fast-setting bite registration material to identify the area of the tray that shows through and remove the area. If you have study models, the tray adjustment can be done using the study models before the patient arrives. Now you have an Easdent tray that can fit into the partial edentulous arch. The teeth on the tray can be moved to the correct position. With the supporting frame, it can be used as a custom tray to take final impression. If necessary, it can also function as a bite block to help record the bite relationship.